My respected brothers and sisters, thank you for joining today's session on ocular pharmacology. My name is Dr. Fahmy, and I'm excited to discuss an important topic with you all: anti-inflammatory drugs used in treating eye conditions. As undergraduate students, you'll find that understanding the mechanisms and applications of these medications is crucial for anyone entering the fields of medicine, pharmacology, or optometry. We'll cover various types of anti-inflammatory drugs, their mechanisms of action, indications for use, and potential side effects. By the end of this presentation, you should have a solid foundation on how these drugs help manage inflammation in ocular diseases, improving patient outcomes and quality of life. I encourage you to take notes throughout the session. Your active participation will make this learning experience more enriching. Let's get started. Inflammation is a complex biological response to harmful stimuli, such as pathogens, tissue damage, or irritants. It's crucial for our body's defense mechanisms, acting as the first line of defense against injuries and infections. When the body detects harmful agents or damaged cells, it triggers inflammation to remove these threats. One of the primary roles of inflammation is to recruit immune cells to the site of injury or infection. These immune cells, including neutrophils and macrophages, are essential in identifying and eliminating pathogens. In addition to removing harmful agents, inflammation plays a critical role in activating the broader immune response. This helps the body to not only address the immediate threat, but also to build a defense against future infections. Moreover, inflammation is vital in initiating the healing process. Once the harmful agents are removed, the body can focus on tissue repair and regeneration. This involves the growth of new cells and the restoration of damaged tissues to their normal function. The process of inflammation is mediated by both chemical and cellular mediators. Chemical mediators, such as histamine and prostaglandins, help to increase blood flow to the affected area and signal immune cells to respond. Cellular mediators, like neutrophils and macrophages, directly engage in eliminating pathogens and cleaning up debris. Understanding the inflammatory response is foundational to grasping how anti-inflammatory drugs work, which we will explore in the upcoming slides. This response, while essential, needs to be carefully regulated because excessive or prolonged inflammation can lead to chronic conditions or tissue damage. Now that we have an understanding of the inflammatory response, let's explore the different types of anti-inflammatory agents used to manage and treat inflammation, particularly in ocular conditions. First, we have steroidal anti-inflammatory agents, commonly known as corticosteroids or glucocorticoids. These drugs are derived from corticosteroid hormones produced by the adrenal glands. They are known for their potent anti-inflammatory and immunosuppressive properties, making them highly effective in reducing inflammation and suppressing the immune response. Some common examples include prednisone and dexamethasone. These drugs work by inhibiting various inflammatory pathways and reducing the production of inflammatory mediators. Next, we have nonsteroidal anti-inflammatory drugs, or NSAIDs. NSAIDs are widely used to reduce inflammation, relieve pain, and lower fever. Their primary mechanism of action involves inhibiting the cyclooxygenase, COX, enzymes, which play a key role in the production of prostaglandins, chemical mediators that promote inflammation, pain, and fever. NSAIDs can be further categorized into non-selective COX inhibitors and selective COX-2 inhibitors. Non-selective COX inhibitors, such as ibuprofen and naproxen, inhibit both COX-1 and COX-2 enzymes, affecting a broad range of inflammatory processes. On the other hand, selective COX-2 inhibitors, like celecoxib and atorvastatin, specifically target the COX-2 enzyme, which is primarily involved in inflammation and pain. This selective inhibition helps to minimize some of the gastrointestinal side effects commonly associated with non-selective NSAIDs. Understanding the different types of anti-inflammatory agents and their mechanisms of action is crucial for effectively managing ocular inflammation. Each class of drugs has its unique benefits and potential side effects, which we need to consider when choosing the appropriate treatment for our patients. Next, we will define what steroids are and explore their various biological roles. A steroid is a type of organic compound characterized by a specific molecular structure consisting of 4 interconnected rings of carbon atoms. This distinctive ring structure is fundamental to all steroids and distinguishes them from other types of organic molecules. Steroids are classified as lipids, which means they are insoluble in water but soluble in organic solvents. This lipid classification is essential for their function and interaction within biological systems. Steroids have a wide range of biological activities. One of their primary roles is serving as hormones. Hormones are chemical messengers that travel through the bloodstream to tissues and organs, regulating various physiological processes. Steroid hormones include cortisol, which regulates metabolism and immune responses, and sex hormones like testosterone and estrogen, which are crucial for the development and functioning of reproductive organs. In addition to their hormonal roles, steroids also play a significant part in regulating metabolism. For example, corticosteroids help control the body's use of fats, proteins, and carbohydrates, ensuring that energy production and storage are balanced. Steroids also influence immune responses. They can modulate the activity of the immune system, making them valuable in treating inflammatory and autoimmune conditions. By suppressing overactive immune responses, steroids can reduce inflammation and prevent tissue damage. Overall, steroids are versatile compounds that are integral to many physiological processes. Their ability to regulate metabolism, influence immune responses, and contribute to reproductive health highlights their importance in maintaining overall health and homeostasis. Now, we will discuss the classification of steroids, highlighting the different types and their specific roles in the body. First, let's talk about corticosteroids. These steroids are naturally produced in the adrenal cortex and are crucial for regulating metabolism, immune response, and inflammation. Corticosteroids can also be synthetically produced for medical purposes, such as reducing inflammation and suppressing the immune system. They are commonly used to treat a variety of inflammatory and autoimmune conditions. Next, we have anabolic steroids, which are synthetic derivatives of testosterone, the male sex hormone. Anabolic steroids are known for promoting muscle growth and development, increasing bone density, and enhancing physical performance. While they have legitimate medical uses, such as in treating delayed puberty and muscle loss due to disease, they are often misused for athletic performance enhancement, leading to significant health risks. Glucocorticoids are a subtype of corticosteroids with potent anti-inflammatory and immunosuppressive properties. They are widely used in the treatment of inflammatory conditions, autoimmune disorders, and allergies. Examples include prednisone and dexamethasone, which help manage symptoms by reducing inflammation and suppressing the immune system's overactivity. Another subtype of corticosteroids is mineralocorticoids. These steroids are involved in regulating electrolyte balance and fluid levels in the body. The primary mineralocorticoid is aldosterone, which acts on the kidneys to promote sodium reabsorption and potassium excretion. This regulation is vital for maintaining blood pressure and overall fluid balance. Lastly, we have sex steroids, which play a crucial role in sexual development, reproduction, and secondary sexual characteristics. This group includes estrogens, progesterone, and testosterone. Estrogens and progesterone are primarily involved in female reproductive health, while testosterone is key to male reproductive development and maintaining muscle mass. Now, let's delve into the mechanism of action of steroids, focusing on how they inhibit pro-inflammatory signaling pathways. Penetration of cell membrane. Steroids are lipophilic, meaning they can easily diffuse across the cell membrane. This characteristic allows them to enter cells readily and reach their intracellular targets. Binding to glucocorticoid receptors, GRs. Once inside the cell, steroids bind to glucocorticoid receptors, which are located in the cytoplasm. These receptors are specific to glucocorticoids, a subtype of corticosteroids known for their potent anti-inflammatory properties. Formation of steroid receptor complex. Upon binding to the glucocorticoid receptors, the steroids form a steroid receptor complex. This complex undergoes a conformational change, activating the glucocorticoid receptor. This activation is crucial for the next steps in the signaling pathway. Nuclear translocation. The activated glucocorticoid receptor complex then translocates from the cytoplasm to the cell nucleus. This movement is essential for the complex to exert its effects on gene expression. Regulation of gene expression. Once in the nucleus, the activated glucocorticoid receptor complex binds to specific DNA sequences known as glucocorticoid response elements, GREs. These GREs are located in the promoter regions of target genes. By binding to these elements, the steroid receptor complex can either promote or inhibit the transcription of these genes. Through this regulation of gene expression, steroids exert their anti-inflammatory effects. They can increase the production of anti-inflammatory proteins while simultaneously reducing the expression of pro-inflammatory genes. This dual action helps to suppress inflammation and modulate the immune response, making steroids highly effective in treating inflammatory conditions, including those affecting the eyes. Continuing from our previous discussion on the mechanism of action of steroids, let's delve deeper into how these compounds inhibit pro-inflammatory signaling pathways and suppress the immune response. Anti-inflammatory effects. Steroids primarily exert their anti-inflammatory effects by inhibiting the transcription of pro-inflammatory genes. These genes include cytokines, such as interleukins and tumor necrosis factor, TNF, chemokines, and various enzymes involved in the inflammatory process. By reducing the transcription of these genes, steroids lead to a decreased production of inflammatory mediators like prostaglandins and leukotrienes. This reduction in pro-inflammatory substances helps to alleviate inflammation and its associated symptoms. Suppression of immune response. In addition to their anti-inflammatory properties, steroids also suppress the immune response. They achieve this by reducing the production of various immune cells, including lymphocytes, eosinophils, and monocytes. Furthermore, steroids inhibit the release of inflammatory mediators from these immune cells. By dampening the immune response, steroids prevent excessive inflammation and immune activity, which can cause tissue damage. Modulation of inflammatory signaling pathways. Steroids interfere with multiple signaling pathways involved in inflammation. One key pathway is the NF-kappa B, nuclear factor kappa light chain enhancer of activated B cells, pathway. This pathway regulates the expression of many pro-inflammatory genes. By inhibiting the NF-kappa B pathway, steroids can effectively reduce the expression of genes that drive inflammation, contributing to their potent anti-inflammatory effects. Inhibition of immune cell migration. Lastly, steroids reduce the migration of immune cells to the site of inflammation. They do this by suppressing the production of adhesion molecules on endothelial cells, which line the blood vessels. These adhesion molecules are crucial for immune cells to attach to the vessel walls and migrate to the site of inflammation. By inhibiting these molecules, steroids limit the movement of immune cells across blood vessels, reducing the influx of inflammatory cells to the affected area. Now, let's examine some of the commonly used steroid medications, particularly focusing on corticosteroids and glucocorticoids, which are frequently prescribed for their potent anti-inflammatory and immunosuppressive properties. Prednisone. Prednisone is a synthetic corticosteroid widely prescribed for a variety of inflammatory and autoimmune conditions. It is typically available in oral form and is used to treat conditions such as asthma, rheumatoid arthritis, lupus, inflammatory bowel disease, and severe allergic reactions. Prednisone works by suppressing the immune system and reducing inflammation, making it effective in managing these chronic conditions. Prednisolone. Prednisolone is another commonly used corticosteroid, often prescribed for treating various inflammatory and allergic conditions. It is particularly effective in managing asthma, dermatitis, and rheumatic disorders. Prednisolone is preferred in some cases over prednisone because it is the active form of the drug and does not require conversion in the liver, making it more effective for patients with liver impairment. Dexamethasone. Dexamethasone is a potent glucocorticoid that is frequently used in emergency situations. It is highly effective in managing severe asthma exacerbations, allergic reactions, and certain types of cancer to reduce inflammation and suppress the immune response. Due to its long duration of action and high potency, dexamethasone is often chosen for acute and severe conditions. Hydrocortisone. Hydrocortisone is commonly used in topical formulations to treat skin conditions such as eczema, dermatitis, and allergic reactions. It is available in creams, lotions, and ointments, making it versatile for different types of skin issues. In its intravenous or intramuscular form, hydrocortisone is used for treating acute adrenal insufficiency and other systemic inflammatory conditions. Its relatively mild potency makes it suitable for less severe conditions and for patients who require long-term steroid therapy. Betamethasone. Betamethasone is a potent corticosteroid available in various formulations, including creams, lotions, and ointments. It is often used topically to treat inflammatory skin conditions like eczema and psoriasis. Due to its high potency, betamethasone is effective in reducing severe inflammation and itching associated with these skin disorders. In this slide, we will discuss the therapeutic uses of steroids, highlighting their applications in treating a variety of medical conditions due to their potent anti-inflammatory and immunosuppressive properties. Inflammatory conditions. Steroids are frequently prescribed to manage various inflammatory conditions. Notably, they are used to treat rheumatoid arthritis and systemic lupus erythematosus, SLE. In these autoimmune diseases, steroids help reduce inflammation, alleviate pain, and suppress the overactive immune response that contributes to tissue damage.
Organ transplantation.
Steroids play a crucial role in organ transplantation. They are essential in preventing organ rejection by suppressing the immune response. Often used in combination with other immunosuppressive medications, steroids help minimize the risk of the body's immune system attacking the transplanted organ, ensuring its successful integration and function. Allergic reactions. In cases of severe allergic reactions, steroids can be prescribed to reduce inflammation and alleviate symptoms such as swelling, itching, and respiratory distress. By modulating the immune response, steroids help manage acute allergic conditions and prevent severe complications. Cancer treatment. Steroids are also utilized in the treatment of certain types of cancer. They are included in treatment regimens to reduce inflammation, manage side effects of chemotherapy, such as nausea and vomiting, and improve appetite. Additionally, steroids can help mitigate some of the immune system's adverse reactions to cancer therapies. Skin conditions. Steroids are commonly used topically to treat a variety of skin conditions, including eczema, psoriasis, and contact dermatitis. Available in forms such as creams, ointments, and lotions, topical steroids reduce inflammation, itching, and redness associated with these dermatological conditions. Their ability to quickly alleviate symptoms makes them a staple in dermatologic treatment. While steroids are highly effective in treating various conditions, their use can also lead to a range of side effects. It's important to be aware of these potential adverse effects to manage and mitigate them effectively. Fluid retention and bloating. One common side effect of steroids is fluid retention, which can cause swelling or bloating, particularly in the face, hands, and feet. This can be uncomfortable and may require dietary adjustments or additional medications to manage. Mood changes. Steroid use can affect mood and behavior. Some individuals may experience mood swings, irritability, or even mood disorders such as anxiety or depression while taking steroids. Monitoring mood and mental health is crucial, and adjustments in dosage or additional support may be necessary. Insomnia. Steroids can disrupt sleep patterns, leading to insomnia or difficulty in falling asleep and staying asleep. Managing the timing of doses and practicing good sleep hygiene can help mitigate this side effect. Increased risk of infections. Because steroids suppress the immune system, they can make individuals more susceptible to infections, such as respiratory tract infections or fungal infections. It's important to monitor for signs of infection and practice good hygiene to reduce this risk. Gastrointestinal issues. Steroids can irritate the lining of the stomach and increase the risk of gastrointestinal problems, including gastritis, stomach ulcers, or gastrointestinal bleeding. Taking steroids with food and using protective medications can help prevent these issues. Increased blood sugar levels. Steroids can raise blood glucose levels, particularly in individuals with pre-existing diabetes or those at risk of developing diabetes. Regular monitoring of blood sugar levels and adjusting diabetes medications as needed are important steps in managing this side effect. High blood pressure. Steroids can elevate blood pressure, which may require monitoring or adjustments in blood pressure management. Regular checkups with a healthcare provider are essential to keep blood pressure under control. Osteoporosis. Prolonged or high-dose steroid use can lead to bone loss and increase the risk of osteoporosis, making bones more prone to fractures. Calcium and vitamin D supplementation, along with weight-bearing exercises, can help maintain bone health. Muscle weakness. Steroids can cause muscle weakness, especially in large muscle groups. Engaging in regular physical activity and strength training can help counteract this effect and maintain muscle function. Understanding these potential side effects is crucial for anyone taking steroids. It helps in recognizing symptoms early and taking appropriate measures to mitigate them. While steroids are powerful tools in managing many conditions, their use must be carefully balanced with the need to minimize adverse effects. While steroids are highly effective in treating various conditions, their use is associated with certain risk factors and contraindications. Understanding these can help in making informed decisions and managing treatment effectively. Infection. Steroids suppress the immune system, which increases the risk of infections. Patients on steroids need to be vigilant about signs of infection and practice good hygiene to minimize this risk. Healthcare providers should monitor for infections and consider prophylactic measures if necessary. Diabetes. Steroids can elevate blood sugar levels and worsen glucose control, which is particularly concerning for individuals with pre-existing diabetes. Regular monitoring of blood glucose levels and adjustments in diabetes management plans are essential when using steroids. Hypertension. Steroids can cause fluid retention and increase blood pressure. Individuals with hypertension need to have their blood pressure closely monitored and may require adjustments to their antihypertensive medications. Osteoporosis. Prolonged steroid use can lead to bone loss and increase the risk of osteoporosis. Patients should be assessed for bone health, and preventive measures such as calcium and vitamin D supplementation, along with weight-bearing exercises, should be considered. Glaucoma and cataracts. Steroid use can increase the risk of developing glaucoma or cataracts. Regular eye exams are crucial for individuals on long-term steroids to detect and manage these conditions early. Peptic ulcer disease and gastrointestinal bleeding. Steroids increase the risk of peptic ulcers and gastrointestinal bleeding. Individuals with a history of ulcers, gastrointestinal bleeding, or other digestive system disorders should use steroids with caution and may require protective medications and close monitoring. Psychiatric disorders. Steroids can cause mood changes and exacerbate existing psychiatric conditions. Individuals with a history of psychiatric disorders should be closely monitored and may require adjustments to their treatment plan while on steroids. It's important to communicate any mood changes to a healthcare provider. Allergies or sensitivities. Individuals with known allergies or sensitivities to steroids or any of their components should avoid steroid use. Alternative treatments should be considered for these patients. Live vaccines. Some steroids can interfere with the immune response to live vaccines, reducing their effectiveness. Patients on steroids should discuss vaccination plans with their healthcare provider to ensure proper timing and efficacy of vaccines. Next, we will discuss non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. These medications play a crucial role in managing pain, inflammation, and fever, making them widely used in both clinical and over-the-counter settings. NSAIDs, or non-steroidal anti-inflammatory drugs, are a class of medications designed to relieve pain, reduce inflammation, and lower fever. Unlike steroids, NSAIDs are not based on steroidal compounds, which distinguishes them from corticosteroids and glucocorticoids. Classification of NSAIDs. NSAIDs can be categorized into two main types based on their mechanism of action on cyclooxygenase, COX, enzymes. For non-selective NSAIDs, these medications inhibit both COX-1 and COX-2 enzymes. The COX-1 enzyme plays a role in protecting the stomach lining and maintaining kidney function, while the COX-2 enzyme is primarily involved in the inflammatory response. By inhibiting both enzymes, non-selective NSAIDs effectively reduce pain and inflammation, but can also cause gastrointestinal side effects due to COX-1 inhibition. Common examples of non-selective NSAIDs include ibuprofen, widely used for pain relief, inflammation reduction, and fever management. Naproxen, effective for treating various forms of arthritis, muscle pain, and menstrual cramps. Diclofenac, often used for more severe pain and inflammation, such as in osteoarthritis and rheumatoid arthritis. Selective COX-2 inhibitors. These medications specifically target the COX-2 enzyme, which is primarily involved in the inflammatory process. By selectively inhibiting COX-2, these drugs aim to reduce inflammation and pain with a lower risk of gastrointestinal side effects compared to non-selective NSAIDs. However, selective COX-2 inhibitors may still have cardiovascular risks. Examples include celecoxib, used for managing osteoarthritis, rheumatoid arthritis, acute pain, and menstrual pain. Etoracoxib, often prescribed for conditions like osteoarthritis, rheumatoid arthritis, and chronic pain due to its long duration of action and COX-2 selectivity. Understanding the differences between these types of NSAIDs helps in selecting the appropriate medication based on the patient's needs and risk factors. It's crucial to balance the benefits of pain and inflammation relief with the potential side effects, especially concerning gastrointestinal and cardiovascular health. In this slide, we will delve into the mechanism of action of NSAIDs, explaining how they work to alleviate pain and reduce inflammation. Unlike corticosteroids, which are synthetic versions of hormones produced by the adrenal glands, NSAIDs operate through a different pathway. NSAIDs work by blocking the production of specific enzymes known as cyclooxygenases or COX enzymes. COX enzymes play a crucial role in the production of prostaglandins. Prostaglandins are lipid compounds that are involved in various physiological processes, including the mediation of pain, inflammation, and fever. There are two main types of COX enzymes. COX-1. This enzyme is involved in maintaining normal cellular functions, such as protecting the stomach lining and regulating blood flow to the kidneys. COX-2. This enzyme is primarily induced during inflammatory responses and is responsible for producing prostaglandins that cause pain and inflammation. Inhibition of COX enzymes by NSAIDs. By inhibiting COX enzymes, NSAIDs reduce the synthesis of prostaglandins. This leads to a decrease in pain, swelling, and inflammation. The mechanism can be summarized as follows. These NSAIDs inhibit both COX-1 and COX-2 enzymes, providing broad anti-inflammatory effects but also increasing the risk of gastrointestinal side effects due to reduced protection of the stomach lining. Selective COX-2 inhibitors. These NSAIDs specifically inhibit the COX-2 enzyme, targeting the inflammatory response while sparing COX-1. This selectivity aims to reduce inflammation and pain with fewer gastrointestinal side effects, although they may carry other risks, such as cardiovascular issues. The inhibition of prostaglandin production by NSAIDs makes them effective in treating a variety of conditions characterized by pain and inflammation. These include arthritis, reducing joint inflammation and pain; muscle injuries, alleviating pain and swelling; menstrual cramps, decreasing uterine contractions and associated discomfort; fever, lowering elevated body temperatures. In this slide, we will explore some of the most commonly used NSAIDs. These medications are effective in relieving pain, reducing inflammation, and lowering fever. We will focus on non-selective COX inhibitors, which inhibit both COX-1 and COX-2 enzymes. Non-selective COX inhibitors target both COX-1 and COX-2 enzymes. While this provides broad anti-inflammatory effects, it also means these medications can have gastrointestinal side effects due to the inhibition of COX-1, which helps protect the stomach lining. Ibuprofen is a widely available non-prescription NSAID. It is commonly used to relieve pain, reduce inflammation, and lower fever. Available in various forms, including tablets, capsules, and oral suspensions, ibuprofen is often chosen for its effectiveness and accessibility. It is used for conditions such as headaches, muscle pain, menstrual cramps, and minor arthritis pain. Naproxen is another non-selective COX inhibitor that is available both over-the-counter and by prescription. It is used for the treatment of pain, inflammation, and fever. Naproxen comes in different formulations, including tablets and extended-release tablets, making it suitable for managing conditions like arthritis, tendinitis, and gout. Its longer half-life allows for less frequent dosing compared to ibuprofen. Diclofenac is a non-selective COX inhibitor available in various forms, including oral tablets, capsules, topical gels, and patches. It is commonly used to relieve pain, inflammation, and swelling associated with conditions such as arthritis and musculoskeletal injuries. The topical forms of diclofenac are particularly useful for targeting specific areas of pain and inflammation with reduced systemic side effects. Understanding the different NSAIDs and their formulations helps in selecting the appropriate medication based on the specific needs of the patient. Whether managing chronic conditions like arthritis or addressing acute pain and inflammation, these NSAIDs provide versatile options for effective symptom relief. Now, let's delve into selective COX-2 inhibitors, a subgroup of NSAIDs that target a specific enzyme known as COX-2. Unlike non-selective NSAIDs, which inhibit both COX-1 and COX-2 enzymes, selective COX-2 inhibitors primarily target COX-2 while sparing COX-1 to a greater extent. By honing in on COX-2, these medications offer potent anti-inflammatory and analgesic effects, potentially minimizing the risk of gastrointestinal side effects commonly associated with non-selective COX inhibitors. Now, let's discuss two commonly prescribed selective COX-2 inhibitors. First up, celecoxib. This medication is frequently used for managing arthritis, including osteoarthritis and rheumatoid arthritis, as well as for relieving acute pain. Celecoxib comes in convenient oral capsule formulations. Next, we have atorvastatin. Similar to celecoxib, atorvastatin is employed to alleviate pain and inflammation associated with various conditions, including arthritis. It's available in oral tablet formulations for easy administration. These selective COX-2 inhibitors offer a targeted approach to pain management, providing relief while potentially minimizing certain side effects. Now, let's explore the diverse therapeutic uses of NSAIDs beyond their anti-inflammatory properties. Firstly, NSAIDs are valuable for fever reduction. By lowering body temperature, they effectively alleviate fever commonly associated with infections, influenza, and various febrile conditions. Additionally, NSAIDs play a crucial role in managing dysmenorrhea or menstrual cramps. Many individuals find relief from the pain and discomfort of menstrual cramps through the use of NSAIDs. For those suffering from migraine headaches, certain NSAIDs such as ibuprofen and naproxen are go-to options for treatment. Whether used alone or in combination with other medications, NSAIDs can help alleviate the intensity and duration of migraine attacks. Moreover, NSAIDs are integral to postoperative pain management strategies. By providing analgesia and reducing the reliance on opioid medications, they contribute to a multimodal approach in managing pain following surgical procedures. These varied therapeutic uses highlight the versatility and efficacy of NSAIDs in addressing a range of medical conditions. As with any medication, it's important to be aware of the potential side effects and precautions associated with NSAIDs. Firstly, NSAIDs can have gastrointestinal effects, ranging from mild discomfort to more serious issues such as ulcers or gastrointestinal bleeding. Secondly, there are cardiovascular risks associated with NSAID use, including an increased chance of heart attack or stroke, particularly with long-term or high-dose usage. Additionally, NSAIDs can lead to renal complications, potentially causing kidney damage or worsening pre-existing kidney conditions. It's crucial to consider precautions and contraindications when using NSAIDs. These may include factors such as a history of gastrointestinal ulcers, cardiovascular disease, or kidney impairment. Before starting NSAID therapy, it's essential to discuss any pre-existing medical conditions or concerns with your healthcare provider to ensure the safest and most appropriate treatment plan. By being mindful of potential side effects and taking necessary precautions, patients can benefit from the therapeutic effects of NSAIDs while minimizing the risks associated with their use. Now, let's examine the key differences between steroids and NSAIDs in terms of their mechanism of action, indications, potency, side effects, and prescription requirements. Firstly, let's explore their mechanisms of action. Steroids work by suppressing the immune system and inhibiting inflammatory processes, while NSAIDs primarily inhibit COX enzymes and reduce prostaglandin production. Moving on to indications, steroids are commonly used for inflammatory conditions, autoimmune diseases, and allergies, whereas NSAIDs find application in pain management, inflammation reduction, fever reduction, arthritis, and musculoskeletal injuries. Now, let's discuss potency. Steroids generally exhibit more potent anti-inflammatory effects compared to NSAIDs, which typically have moderate anti-inflammatory effects. Next, let's consider side effects. Steroids can lead to adverse effects such as adrenal suppression, osteoporosis, weight gain, increased infection risk, and mood changes. Conversely, NSAIDs may cause gastrointestinal ulcers, bleeding, kidney problems, cardiovascular risks, among others. Lastly, prescription requirements. Steroids generally require a prescription, while NSAIDs vary. Some are available over the counter, OTC, while others necessitate a prescription. Understanding these distinctions is crucial for healthcare providers when selecting the most appropriate treatment for patients, considering factors such as the severity of the condition, potential side effects, and individual patient characteristics. Let's delve into the onset of action of NSAIDs and how it varies depending on the route of administration. Firstly, let's consider oral NSAIDs. The onset of action of oral NSAIDs varies, typically ranging from 30 minutes to 1 hour after ingestion. However, it's important to note that the full analgesic and anti-inflammatory effects may take several hours to develop. Moving on to topical NSAIDs. Topical NSAIDs, such as gels, creams, or patches, offer localized pain relief and often have a more rapid onset of action compared to oral NSAIDs. Patients may experience relief within 30 minutes to 1 hour after application. Lastly, let's discuss intravenous 4 NSAIDs. 4 NSAIDs, administered in a healthcare setting, provide a more rapid onset of action, often within minutes. This makes them particularly useful for acute pain management scenarios where immediate relief is needed. Let's move on and delve into the safety considerations and precautions associated with the use of NSAIDs to ensure optimal patient care. Firstly, let's discuss gastrointestinal (GI) risks. To minimize GI risks, it's advisable to use the lowest effective dose for the shortest duration necessary. Additionally, co-administration of gastroprotective agents may be considered in certain high-risk individuals. Moving on to cardiovascular risks. Individuals at risk for cardiovascular events should use NSAIDs with caution and under the guidance of a healthcare professional. It's essential to discuss any cardiovascular concerns with a healthcare provider before using NSAIDs. Next, let's address renal, kidney risks. Close monitoring of renal function, adequate hydration, and appropriate dose adjustment may be necessary in individuals at risk of renal complications. Lastly, allergic reactions. Some individuals may be hypersensitive or allergic to NSAIDs. Allergic reactions can range from mild symptoms like skin rashes to severe reactions, such as difficulty breathing or anaphylaxis. By understanding and addressing these safety considerations and precautions, healthcare providers can ensure the safe and effective use of NSAIDs in their patients. Last but not least, let's explore the significance of adopting a balanced approach to anti-inflammatory therapy for optimizing patient outcomes and ensuring the highest standard of care. Firstly, maximizing therapeutic benefits. A balanced approach aims to maximize the therapeutic benefits of anti-inflammatory therapy, effectively managing inflammation and associated symptoms to improve patient comfort and quality of life. Secondly, tailoring treatment to individual needs. Every patient is unique, and their response to anti-inflammatory therapy may vary. By tailoring treatment to individual needs, healthcare providers can ensure that patients receive personalized care that addresses their specific symptoms, preferences, and medical history. Thirdly, minimizing side effects and risks. While anti-inflammatory therapy can be beneficial, it's essential to minimize the risk of potential side effects and adverse reactions. A balanced approach involves carefully weighing the benefits against the risks and implementing strategies to mitigate side effects whenever possible. Fourthly, adopting a multimodal approach. In many cases, a single approach may not be sufficient to effectively manage inflammation. A balanced approach advocates for a multimodal treatment strategy that combines different therapies, such as medication, physical therapy, and lifestyle modifications, to achieve optimal results. Lastly, considering individual risk factors and comorbidities. Patients may have underlying health conditions or risk factors that influence their response to anti-inflammatory therapy. By considering these factors and addressing any comorbidities, healthcare providers can tailor treatment plans to minimize complications and maximize efficacy. In conclusion, adopting a balanced approach to anti-inflammatory therapy is essential for achieving the best possible outcomes for patients. By maximizing therapeutic benefits, tailoring treatment, minimizing side effects, embracing a multimodal approach, and considering individual risk factors, healthcare providers can deliver personalized care that optimizes patient well-being and quality of life. As we conclude our presentation, I want to extend my sincere gratitude for your attention and engagement. May you gain valuable insights and knowledge from our discussion today. Remember, every learning opportunity is a chance for personal growth and development. Have a wonderful day ahead, filled with positivity and progress. Thank you, and take care.